wanted to also ask a couple of questions as it relates to just the key messages. As a communications consultant and a behavioral change communications consultant, I really find it to be interesting and impactful when we really dive down to strategic communications, specifically with key messages. And so, are there any particular key messages that you think we should be addressing in public health campaigns or awareness campaigns to resonate with Black communities about mental health?
I think that your organization and what you're doing, I mentioned it before, is ideal because y'all are very good, particularly those individuals in your organization who have had training in public health. Y'all are very good at, to me, passing along certain messages. So the collaboration between public health and psychology and organizations like this is important. A couple of things, though, to concentrate on. The most prevalent form of mental disorder is a combination of trauma and depression. So messages centering around that, I think, would be very, very important. The individuals who are more at risk, identifying them, and then campaigns dealing with the people who are more at risk. We talked about suicide and African-American males. Now remember, homicide is the second leading cause of death for young African-American males. But I can imagine just walking around with the stress, dealing with whether I'm going to get hurt. So messages around that, messages not so much on the violence, but how stress can lead to a lot of paranoia, vigilance, and things like that. But the main thing, in my opinion, is that to have a mental health condition, it's not the end of the world. To have a mental health condition doesn't mean that you are a bad person.
With all of those things in mind and challenges, like how do you foresee, even with the best key messages and the best studies out there, how do you foresee us really trying to move the needle and really moving the needle towards social and behavioral change?
Not giving up and seeing it's going to be a long struggle. We have to do more about Medicare and Medicaid expansion. The systemic stuff, you're right, is rather challenging, but I do think that we have to take a long look at insurances. We have to take a long look at people who are vulnerable and kind of connect the two.
Thank you. I'd like to thank you for this interview and just the conversation in general. As a communications consultant and as, of course, the founder and president of PivotPath, our main goal is to ensure social behavioral change and it being sustainable, right? We can create these campaigns and create the graphics and the creative for it. We really want to see measure and efficacy and sustainability of the efforts that we put forth. And so having these kind of conversations is really important. It allows us to kind of think outside of the box,
Sure.
Not being unrealistic with the current conditions of what's taking place, but just trying to find ways that are a bit more humanistic and relatable to really penetrating and having these conversations that I think are very important for our communities.
Don't give up, and collaboration. That's really important.
Thank you so much
Thanks for having
us,
me.
and thank you.
Yep.